Hi, this is Dr. Tom Rogers coming to you with the Common Sense MD on another Monday, talking hopefully about something beneficial to your health. I think I've got some really good news here today about vitamins. I've been questioned, what now? We know these vitamins helped me during COVID, the higher dose vitamins. What should I do now? Should I stay on vitamins? You should definitely stay on your vitamins. We're all about prevention. We know that higher dose vitamins, including IV vitamins, especially C, fight diseases of many kinds. But what we're trying to do with our practice, of course, is prevent diseases. That's what functional integrated medicine is all about. So definitely you should take your vitamins for the rest of your life. You don't need to take 50,000 a D daily for 3 to 5 days like you do when you have COVID, or 4,000 of C. You certainly need to take 1 to 2,000 of C. But for a list of my complete vitamins, of course, come by the office or look on the website. My top vitamin has always been vitamin D by far. Of course, it's a hormone, not even a vitamin. And then the list trickles down. But I want to talk again about vitamin D because it's so important. And I want to talk about a new study that came out from Germany relating vitamin D and cancer deaths, prevention of cancer deaths. They did a huge study out of Germany, and it showed just by giving 1,000 units of vitamin D, of course, the benefits, we use more than 1,000. Typically, my patients take 5,000 a day, sometimes more, and you follow the levels. To get a vitamin D level's dirt cheap. But just using 1,000 units of vitamin D prevented cancer deaths in Germany by anywhere from 13 to 25%. This was a really interesting study because it kind of said in the end, the conclusion was that for adults over 50 years old, we should be giving everybody vitamin D, not only to prevent their death, but to save a lot of money for the national healthcare system. In Germany, it's a totally government-run system, and they proved how many billions of dollars it would save them if they just gave vitamin D to everybody. And this is going to get interesting in a minute because it relates to my other big thing that I fight daily in my practice, obesity. But hold that thought for a minute. But end of life. People over 50 talking about cancer related deaths. The end-of-life cancer care is very expensive. In fact, it's 4 times more expensive than dying of heart disease. Heart disease is the number 1 killer. Cancer is the number 2 killer. So end-of-life cancer treatment is 4 times more costly than dying of heart disease. And a lot of times, as you know, the last year of life is just spent in misery if you have end-stage cancer. We always hold out hope, but it's a lot easier way to go with heart disease, I think. And the interesting thing about this was that vitamin D really reduced those cancer deaths. That was confirmed by a subsequent Harvard study that had, I think, 27,000 people in it. I think it was the largest vitamin D study ever. And that Harvard study confirmed the studies out of Germany. In the U.S., it was probably more close to 25% reductions in cancer deaths. But there's a couple interesting things about this. One is that it didn't really reduce the incidence of cancer. It just reduced the cancer deaths. So whether it changed the cancer morphology, the tumor morphology, or how it exactly worked, nobody's exactly sure. It for sure decreased metastasis. So, our bodies are always trying to get cancer, and our bodies have an amazing way, if you're healthy, of fighting cancer cells off, because we've all got them in us. So I thought that was really interesting in that it didn't reduce cancer, it just reduced the deaths. I mean, the other really interesting thing that I found that ties into what I said previously was that the effect was for people that had a normal weight, body weight, normal BMI. The decrease in cancer deaths really didn't apply to obese folks. So, we know obesity is an inflammatory producing organ, abdominal obesity, and it's a cancer causing medical condition. But it was really interesting that even the people that were obese that took the vitamin D, it didn't really help prevent deaths from that group, only in the people with normal BMIs. To me, that's a huge statement right there. I've said for years that this country would not have a healthcare crisis if we did two things. Number one, and I've been saying this for years, give every human vitamin D, starting from kids to adults, and now especially over 50 to prevent cancer deaths. We know it prevents COVID and COVID deaths. And now this huge study comes out about cancer deaths in those over 50, which I think is something like over 600,000 Americans over 50 die of cancer every year, and it costs billions of dollars. So huge. But I've said for years, like I just stated, if we would give every human vitamin D and one other factor, if we went back to our average weight back in 1960, 160 pounds for men, 115 for women, that's the average United States weight, there would be no healthcare crisis. So the bottom line on this thing is everybody take vitamin D and try to get to a lean weight so that it'll actually help prevent cancer deaths as well as all the other great things it does. Like help your mood, it helps you lose weight, helps prevent diabetes, helps your blood pressure, helps prevent osteoporosis. That's well known, but that there's so many reasons to take vitamin D that I could list them. The list would be that long. So take vitamin D, D3, and if you're over 40, D with K. It makes the D more absorbable, so that the calcium will go into your bones, not your arteries. So another podcast on vitamin D. I don't know how I can overemphasize how everybody should be taking vitamin D3 and checking levels. I hope this helps you. Please take your vitamin D. If you saw me with my sign on the interstate, take vitamin D. It was kind of funny, but hopefully very useful to people who saw it driving down the road. But anyway, I hope this helps. Another great study about vitamin D. I'll see you next week.